You can see my screen, right?
Yeah, yes.
Hello, everyone. Welcome to GCAR's monthly General Club meeting. GCAR stands for Global Council for Ayurveda Research, and our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. And our vision is to promote and establish Ayurveda as an evidence-based health science globally. So you can visit ayurvedaresearchusa.org to learn more about us. We are a non-profit organization, and as you know, every non-profit organization, they need volunteers to run and establish itself and to grow. So we urge you to join us as a volunteer. You can go to our website ayurvedaresearchusa.org, and then you can click on joining as a volunteer, fill up the form, and that way you can help us also to grow and promote our mission and vision. In today's General Club meeting, our speaker is already here, and our speaker is Shiji Vasan. She is a very renowned, very educated professional, and she has a background in clinical research with more than 14 years of experience in clinical operations, program management, and healthcare research. Shiji earned her MD in Swasthavrita from Government Ayurvedic College, Tiruvananthapuram, Kerala. And she served as a senior medical officer for Kerala, Government of Kerala. She later completed her MS in Global Health Policy and Management from Brandeis University, USA, where she contributed to NIH-funded research on addiction and disability policy. Shiji also has held the role of program manager for health system strengthening initiatives in India with a focus on public health delivery and program evaluation. Her research portfolio includes epidemiology, evidence-based evaluation of public health programs, such as cost effectiveness studies on HPV vaccination and robotic surgery, and the integration of traditional systems like Ayurveda into contemporary health frameworks. She currently serves as a research associate in intraventricular radiology at Boston's Children's Hospital, where she supports research and clinical operations in vascular anomalies. She is committed to advancing rigorous research methodologies to build global evidence base for Ayurveda and integrative medicine. So I'm going to stop sharing my screen, and here is to Shiji. She will take over.
Hi. Hi, everyone. I thank you, GCAR, for inviting me to present today. So, being to the presentation, I took a study on assessing the effect of an Ayurveda formulation with yoga and specific dietary plan for prameha, which we can call diabetes mellitus. Specifically, they have taken type 2 diabetes mellitus here. So the name of the study is The Efficacy of Integrated Ayurveda Treatment in Type 2 Diabetes Mellitus with special reference to prameha, a randomized controlled trial, a critical review. And this study was published in International Journal of Ayurvedic Medicine, volume 15-1 in 2024.
We can't see your screen.
Oh, sorry.
No worries.
Okay. Can you see the screen?
Yes, I see the first screen with the title.
Okay, thank you.
Thanks.
So the name of the study is Efficacy of Integrated Ayurveda Treatment in Type 2 Diabetes Mellitus with special reference to Prameha, a randomized controlled trial. And this study was published in International Journal of Ayurvedic Medicine, volume 15.1 in 2024. And the authors are Suketa Kumari, Basavaraja Tubaki, Rekha Patil, Lakshmikant S.T. and Dulappa M. They're all from different Ayurveda colleges in India. And the disclaimer, this presentation is intended solely for educational and research purposes. The content is designed for audiences with a Bachelor of Ayurvedic Medicine and Surgery background. Ayurveda is not a regulated or licensed system of medicine in the United States. The information provided here does not constitute medical advice and should not be used as a substitute for consultation with licensed healthcare providers. The opinions and interpretations expressed here are exclusively those of the presenter and do not necessarily reflect the views of any affiliated institution. And the aims and objectives of this study is to compare integrated Ayurveda treatment with standard diabetic treatment for Prameha. That is a standard diabetic treatment for diabetes mellitus type 2. The background and significance. We all know the type 2 diabetes mellitus is a global health challenge and it is growing. The forecasted prevalence rate of type 2 diabetes globally is estimated to be 7,862 per 100,000. And this is a time series modeling forecast from the global burden of disease data, and the reference is given here. So we know conventional management has limitations in controlling the hyperglycemia and the quality of life. There are side effects also. So pragmatic urgings that manage hyperglycemia and patient-reported outcomes are always valuable. And here, Ayurveda proposes integrated approaches, that is Ayurveda formulations, different kinds of Ayurveda formulations plus diet and yoga. This particular study aims to test the efficacy of integrated Ayurveda treatment as an adjunct to standard diabetic care. So the study design here adopted is a randomized controlled open label parallel group trial. And the standard diabetic treatment is metformin plus American Diabetic Association approved diet pattern, the lifestyle modifications, which is any activity the study participant can involve. For minimum 3 days, they have to do 15 minutes each per day. That is 150 minutes per week they should complete. And integrated Ayurveda treatment is metformin plus MGV, the study drug, that is Madhumehari Ghanavadi, tablet form, plus Ayurvedic diet, specific Ayurvedic diet given to the study participants of this arm, and then yoga. And the duration of the study is 90 days. 200 participants were included in the study for 2 arms, that is 100 participants each in both arms. And the inclusion criteria here, adults from 18 to 70 years of old, they are diagnosed with type 2 diabetes mellitus. Their HbA1c should be between 7 and 10.5 at the time of screening, on a stable metformin therapy for at least 3 months. They are willing to comply with diet, yoga, and medication protocols, and they should provide informed consent. So those who can comply with these are included in the study population. And the exclusion criteria are use of oral hypoglycemic drugs other than metformin. So we all know if the HbA1c is between 7 and 10.5, as per the modern protocol, the patients should be moved to one more anti-hyperglycemic drug other than metformin. So they have excluded that. Only metformin using patients are included in this study. And the other exclusion criteria are the patients on insulin therapy excluded. presence of serious comorbid conditions like renal, hepatic, cardiac, malignancies, pregnant or lactating woman, that's a general exclusion criteria. History of allergy to any trial drug component. So the Madhumehari Ghanavadi, if the patient is allergic to any of the drug components which contains 10 drugs, so the such kind of patients are also excluded. Participation in another clinical trial within the last 3 months, and known compliance risk, like they are taking alcohol or they are under any other uh, medication for psychiatric illness, and if they cannot comply with the yoga or diet plan, particular Ayurvedic diet plan. So such patients are excluded from this study. And the methodology is they randomize the patients with a block size 2, and the allocation sequences were generated by a computer producing random numbers. And in the study, it's mentioned that no blinding. So it's an open label study, which means both the participants, that the patients and the investigators, all knew which patient is assigned to which arm, like standard diabetic treatment or integrated Ayurveda treatment. And the sample size I mentioned earlier, 100 per arm. And the outcomes measured here in the study are HbA1c, that is measured at the beginning of the study and at the end of the study. So that is 0 day and the 90th day. And then FBS or PPBS, that's which was measured at the beginning and 30th day, 60th day, and 90th day. Then this HOMA IR they have calculated. HOMA IR is like checking the insulin resistance, which is calculated using a formula with the FBS measure. And it was measured at the beginning of the study and end of the study. Lipid profile was also measured. Then anthropometry, that is weight and BMI, it was measured during different time. And the quality of life, that is they mentioned like general quality of life measuring scale was used, but the details were not given. And the Ayurvedic scales they used were Prameha Purvarupa and Prameha Rupa, which were graded into scale. And these are the Purvarupas they used to assess before and after treatment. Madhurya Masya, that is feeling of sweetness in the mouth. Then Anga Shaitilya, flaccidity of muscles. Alasya, laziness or indolence. Shida Priyatva, preference for cold food or environment. Angagandha, body odor. Shramashwasa, dyspnea or on exertion. Svedadikyada, excessive sweating. Angasada, physical fatigability. So these are the 8 Purvarupas the investigators used for assessment here. And the interpretation in interpretation is from the parties, the investigators themselves. So all these parameters are graded on a 0 to 3 scale, where 0 is absent, 1 is mild, 2 moderate, and 3 severe. They used it for the statistical analysis. And the Prameha Rupa, 6 Rupas were assessed in the study. That is Mutra Madhurya, presence of glucose in urine. Prabhuta Mutrada, frequency of urination. Vipasadikya, Kshudadikya, increased thirst and appetite. Klama, mental fatigue. The Purisha Baddhada, constipation. So these rupas are also assessed on the same scale. That is, no, 0 absent, 1 mild, 2 moderate, 3 severe. And in the study, the statistical analysis, they use the data for the complete cases only. Intention to treat was not specified here. That means they used all the patients who have completed the study. Descriptive statistics, they use the continuous variables, mean and standard deviation for assessing the continuous variables, categorical with percentage, and they did the baseline comparison using chi-square test for the categorical variables and Mann-Whitney test for the continuous variables. Between group comparisons, Mann-Whitney U at follow-ups, Within group changes, they use the Wilcoxon sign rank at 2 time points and Friedman test at multiple time points. Alpha level, two-sided alpha for 5%. That means they are expecting a type 1 error at 5%, means false positivity can be accounted for 5% in the study. No multiplicity corrections were mentioned because they have assessed the study at multiple points, like at the beginning, then 30th day, then 60th day, and then 90th day. So for the reporting, they have given the p-values, but missed the confidence intervals or any adjusted models. And the results, the HbA1c was reduced 16% in integrated Ayurveda therapy, but it was just 4.8% in standard diabetic treatment. FBS and the insulin resistance improved more in integrated Ayurveda treatment. Quality of life and subjective features improved in integrated Ayurveda treatment. They have mentioned attrition, that is a drop off. 8 patients were dropped out in standard diabetes treatment and 12 patients were integrated Ayurveda treatment. And these attrition patients' data were not used for the statistical analysis of this study. And they have mentioned no major adverse events reported during the study. And if we look at the strength of this study, that is a randomized design, large sample size for complementary medicine. They have included 200 patients, 100 for the control and then 100 for the study population. And they have registered in the CTRI and ethical approval was obtained. And they have mentioned there were no adverse reaction. That means they have monitored if any adverse reaction is there. And coming to the limitations, we can see it's an open label, no blinding, concealment not described. So from that, we can assume, as I said earlier, both the participants and the investigators, the patients and the investigators were aware that which patient gets which treatment. So that can lead to bias, performance bias and attention bias. Like performance bias from the part of patients, like they know they have been assigned to the integrated Ayurveda therapy, integrated Ayurveda treatment arm. So they will try to stick on to that for that limited period. And also the investigators knew that the patient, because they are testing a hypothesis, they might be more interested in getting a good result for that hypothesis, which can lead to the attention bias. Like they give more descriptions to the patients in integrated Ayurveda treatment, like all the diet plans should be followed promptly, sticking to the medications correctly, and such kind of things can be given. So it can lead to the attention bias. Then this is a bundle intervention. Like in the standard diabetic treatment, they have included metformin plus American Diabetic Association guideline diet plan, and then lifestyle modification, including some kind of activity. And in the integrated Ayurveda treatment, they have included Madhu Mehari Ghanavadi, which has 10 drugs, and then they have suggested specific diet plan. So that diet plan is like morning drink, any one morning drink, like herbal infused drink, lemon added, ginger lemon water, cinnamon water, and fenugreek water. So that's also a confounding factor, I can say, because we all know it is evident that fenugreek has a quality in controlling hyperglycemia. And there are many studies available to prove that. So we are not aware here, like those patients who have stick on to the fenugreek water as a morning drink, how it affected this study result. And they have breakfast options. That's okay, general breakfast options like gram flour dosha, herbal chutney, millet dosha, millet vegetable upma, like that. But that's the general diabetic diet plan. And mid morning snack, that's buttermilk. Then lunch they have, that's a salad. And mid evening snack, then dinner. So they have preferred millets for the diet plan for in Ayurveda. Ayurveda, integrated Ayurveda therapy arm. Um, so also they have yoga, but in the study we have no detailed description regarding what kind of yoga they have adopted in the study, whether it was breathing practices or asanas or all involved. We have no information on the yoga practices here. So it can also lead to attention imbalance. Like um, they may have been given, like we all know, some yoga asanas have effect on reducing hyperglycemia, and it is also published materials available. There are published materials available on that yoga practices also. So maybe those who are having higher HbA1c, like up to 10.5, may have been given those specific yoga practices. There is no information on that. So that can also lead to attention imbalance, which can uh, increase the type 1 error, that's false positives in the study. And also in the study, we can see that they haven't mentioned a specific primary endpoint or primary outcome. Um, like whether they are focusing on reducing the HbA1c or any other fasting blood glucose, but they have gone for different uh, outcomes here. Like they have assessed so many criteria. And regarding power analysis, the authors mentioned that they did power analysis and then concluded 200 study participants are enough to get a 5% type 1 error accepted statistical analysis in this. But they haven't mentioned the details, how they have done that. And regarding multiplicity, there are baseline imbalances. We can say like the age category is from 18 to 70 years of old. So, and there are also and coming to the generalizability, or this is a single center study, so that it means single center study for just 90 days. So it limits the generalizability, so that the study cannot, we cannot say that it can be applicable to anyone who is having type 2 diabetes mellitus within this age group with this HbA1c measurement. And what can be done to improve the uh, acceptability of this study? Like predefine one primary endpoint, one primary outcome with power calculation. Like they can mention for that specific primary outcome how the power analysis has been done. And blinded outcome assessment to reduce the bias, like the performance bias from the side of participants and also the attention bias from the investigators. We can use the blinded study design. And here they have used only two arms, that's the standard diabetic treatment and then the integrated Ayurveda treatment. But they have included so many factors in these two arms. So it would have been better if they have opted for three arms, that is standard diabetic treatment and then standard diabetic treatment plus yoga, then integrated Ayurveda treatment, so that they can specifically assess in this integrated Ayurveda treatment whether that was Madhumehari Ghanavadi produced more effect, or was it a compound effect with yoga and diet plan. And also they should have adopted specific diet plan for all the three groups, so that they can eliminate the bias from the diet plan. And for the statistical analysis, actually they used for the descriptive analysis, they used the mean and standard deviation. For baseline comparability, they used chi-square test and Mann-Whitney U test. So they haven't mentioned about whether they tried any other different adjustment models in the study, which can reduce the bias, which can look for the confounding variables included in study. Most of the time, for the health research, we have to look for confounding variables. And the study that is matching for this trial, this randomized trial, was mixed effects models for repeated measures, like measuring at the beginning of the study, then at the 30th day interval, 60th day interval, and 90 days, so that they can get an assessment about like adjusting for the type 1 error, what changes happened within the group and between the groups. And the follow-up, which can be extended to 6 to 12 months, which can give more robustness to the study. And they, the authors mentioned there were no adverse events reported, but it's not mentioned how they monitored that. And they have mentioned 12 patients dropped out from the integrated Ayurveda therapy. And what are the measures they taken for the adherence of patients? It's not mentioned in the study. So, in my opinion, they can improve the statistical evidence and the clinical evidence for this study if they can address all these effects. And the overall assessment of these studies, like integrated Ayurveda treatment, shows promising add-on benefits. Like from the result, we can see HbA1c reduced 16.6% in the integrated Ayurveda treatment arm. So that's a good result. So integrated Ayurveda treatment can give promising benefits. There are some methodological flaws which limits the confidence in the study result. Hypothesis generating study rather than confirmatory. That's the study points out. Publishable with, oh, that was not part of this thing. Okay, so that's the oral assessment of this study. And this is what I analyzed from this study. Thank you.
Thank you, Shiji, now for a great presentation. I learned a lot. I have one question. So it has been proven, like some of the research, and that millets are a better option for diet for people with type 2 diabetes or people with pre-diabetes. And the group one was given American Diabetes Association approved diet.
Yeah,
So I'm assuming that diet is more lean towards protein.
yeah, yes.
Because I have studied that diet, I have some certifications from them. So they focus on high protein, high fiber
Yeah,
diet.
yes.
So both, like Ayurvedic diet does not focus on proteins alone, it focuses on shadras and six taste and millets and So it's a different type of diets. Did they mention in the study that they found any complications with the high protein, high fiber diet? Because if people are not hydrating properly, there can be complications with that high protein.
No, they haven't mentioned anything like that specifically for the diet plan.
Okay. Yeah, that's the only question I had. Thank you. So thank you everyone for listening to our presentation and watching the recording. As I mentioned earlier, GCAR is a non-profit organization, so we highly appreciate your participation. If you consider to join us as a volunteer, that would be highly appreciated. And thank you and have a wonderful day.
Thank you. Thank you all.